Today, I'll be sharing with you a topic titled Frustration of Patients and Health Practitioners, the inadequacies and substandardness of Africa's health system. So, all we pray and yearn for is a better health so as to continue with our education, businesses, leadership, and daily activities. But the faulty health system in Africa cannot permit such prayers to be answered. So, most of us who can afford health services abroad travel out to get medical attention, ignoring our continent, Africa, because we think that we cannot offer the best. How about those who cannot afford these health services abroad? Or better still, what about the moments of global pandemic, like during coronavirus? Every country abroad relied on the strength of their health care system to curb or manage the virus spread. Bringing it down to Africa, how was she able to manage hers? To be clear, we all, both the poor and the rich, are in this challenge together. So a typical example of the faulty health system in Africa is in its file record or documentation system. So this file record system is very faulty, and that is why I would like us to imagine a scenario whereby you have a sick relative, and then you are bringing the person to a hospital in Africa. Now, approaching the hospital, you are mandated to first open a file, get a card, all right? Then after, you make a deposit before you are even allowed to see the doctor. And come to think of it, all of these, there may be a queue that your sick relative would have to be in line to wait for their turn. So this narrative is a typical scenario of the faulty or broken system of the health system of Africa. So because of this, I and my team at ALX are bringing a potential solution called the HealthVault 509 to you. And by so doing, I'm going to walk us through this potential app that has so many promises that can curb the broken system of the health care system in Africa. So let's proceed with the slide. So now this is the first page of the slide. This is the first page of the slide. It is named the HealthVault 509, Evolving Health. So our global challenge and global opportunities on healthcare. So, and the problem statement aims to address the lack of health information database in Africa. Specifically, our solution focuses on developing a specialized and secure, user-friendly, cloud-based storage system for healthcare, strictly in Africa. Then a question might be asked, why does the problem matter? Why does the lack of an information health storage system matter in Africa? Well, it matters because it is crucial for saving lives. It is very crucial to save lives. So addressing data privacy also for vulnerable populations like the migrants and improving timely access to medical care. So just like the scenario that we just shared, your sick relative coming to the hospital and the person is being mandated to stand in the queue with such emergency, no care, no attention. Before you attended to, you must open a file and make a deposit, okay? So this is what our app will tend to address. So moving along, our user persona, we are focusing on a particular user named Similola Arimiroro. Is a 32-year-old software engineer working in Lagos. So she moved from a rural area to a city for better job opportunity. and healthcare facility with her 2 sons and husband. Now, despite her urban lifestyle, she often faces challenges accessing her medical records and managing her family's health information due to fragmented healthcare system and inadequate database management in the region. So now, now this user often faces this challenge because Africa, mainly Nigeria, where this particular user is located, depends or runs on a file management storage system. Okay, so what if there is a fire outbreak or a theft of identity? How does this user tend to cope with that or live with that? So let's move on to the available data for this. So now, according to the forecast up to 2030, so we have the use of electronic medical record market size, and from this our research data here, we have that Africa have the lowest use of EHR system or EMR system. That's the electronic health record system or the electronic medical record. So Africa is the continent that makes use of this particular innovation or technology the least, to show you how backward our technology is in the health sector. All right, so moving on, we have the use of the EHR for healthcare services from USA Health Database Storage. So we can see here that the US has employed the use of EHR in several aspects of their health, system. So there is patient demographics. So they use it in patient demographics and biography, and also in medical list, nurse notes, advanced directive, discharge summaries, problem list, and physician notes. So they apply this EHR across each and every aspect of their health sector. And that is why they are booming. That is why they are doing very well over there. And also, we can see here that each and every hospital has adopted this EHR in US. Okay, so the hospital service type has adopted this EHR system. So down to the general acute care, the psychiatric services, the specialties. Of course, the specialties have this low. Why? Because of the fact that patients would want to meet with their physicians physically on a special occasions, okay, on a special attention. But other ones such as acute long-term care, the children's services, and the rehabilitations, all of them have a higher rate of adoption outside of this specialty. So to tell you that this EHR system is by far advantageous if adopted. So our app or our solution seeks to secure and provide a user-friendly cloud-based health information database system designed to address the challenges faced by individuals such as our user persona, similarly, and also allowing her to access her medical records in Africa, and also her health practitioners or health professionals being able to also access her own medical record without even meeting themselves. So the platform aims to centralize health information, enhance data security and privacy, facilitate seamless communication between healthcare providers and patients, and expedite diagnosis and treatment procedures. So why did we choose this solution? So the solution centralizes health information, making it easier for individuals and healthcare providers to access and manage medical records efficiently, reducing fragmentation and improving coordination of care. So why HealthVault 509 is likely to be effective? This is because by centralizing health information and streamlining communication between healthcare providers and patients, the HealthVault app facilitates easier access to medical record, diagnosis, and treatment option, thereby, improving healthcare outcomes. So this is a typical example of our wireframe that we have designed. So let me zoom this a little for magnification. All right. So here, this is a login page. So the user here inputs their ID and their password, and that will give them the authentication to log into the app. So therefore, if the user happens by chance to forget their password, they can click on this forget password here. And also there is a privacy statement, an agreement that they will have to click to show us that they agree to our data privacy management rules. Okay, so they cannot have access to any other data apart from theirs. So when they log into this app, the HealthVault 509 app, so it will lead them straight to their dashboard. So in their dashboard, they will be able to see their registered biography, which of course in the traditional way, they will have to open a file back in the hospital, but then that will not be needed. Here, they will have to impute everything that will be needed by the doctors, okay? Both their place of birth, dates of birth, their agenda, contact information, and also emergency contact, okay? And of course, a picture of their photograph. So here also, you are going to see their medical history, the prescription of the doctors that they have received, further appointments that they have booked to their doctors, insurance that they have, insurance scheme that they have been on, also immunizations if any, then the reports of maybe how effective their experience with their doctors have been. They can as well put it here. Also, if they need any need for help or support, they can also click here. All right. So moving on to the third item here, we have the appointment. So in a scenario whereby they have booked appointments, they want to book appointments with their health professionals. So here they can be able to do that. They can schedule an appointment by their date and by their time, also call the doctor's office line. So immediately that this happens, is going to connect directly with their doctors anywhere they are based on their mobile phones. Once the particular doctor or the health professional installs that app on their mobile phones. So when they book an appointment, a notification will be sent also to the doctors to ensure that this schedule matches with the schedule of the health professional himself or herself. All right. So moving on, we have let me zoom out a little. Sorry. So we have the needs and the pain points of the users of this app. So the app is not void of any is not void of needs also, or the pain points. So our users might encounter challenges, okay, while using the app. And these challenges are in three places. First of all, the users might feel frustrated and anxious about how they cannot quickly find accurate and up-to-date contact information for the specific health specialist they need, okay? Particularly during emergencies, leading to delays in receiving timely medical care. So the second pain point here are users are skeptical in sharing their sensitive health data. All right. So one might be scared if I share my condition here. What if it gets stolen and my identity get publicized? All right. Or they might have concerns such as, is this app secured enough, or is there proper security that hackers cannot easily access? All right. So the third pain point here is dissatisfaction with generic or one-size-fits-for-all treatment program that do not consider their individual medical history, genetic information, lifestyle choices, and preferences, leading to suboptimal health outcomes and dissatisfaction with the health services received. So these 3 pain points in the next slide have solutions. All right. So the first pain point, we intend to implement a searchable and updated directory of health specialists within the app. So we are going to update the app with health specialists that each user that tends to register in the app will tend to find a specialist pertaining to their cases. Okay. So also the second point here, we are going to enhance data security and privacy safeguards by implementing robust encryption method. Also, the cloud-based system is going to ensure this security. Okay. And also we intend to use firewalls as an extra security backup. Okay. So the third point here is we intend to develop a personalized health management system within the app that integrates users' medical history. So as you register in the app, you will get to update us or impute your medical history so that each and every health practitioner or health specialist that you want to contact can be able to view your history without coming to contact you for that information. So on contacting you or you contacting them, there won't be any wastage of time of them trying to know your medical history anymore, but they will now be directed straight to your treatment procedures. Okay, so moving on to the solution, to the next slide, sorry. So we have our call to action. So we are calling our sponsors for sponsorship so that we can be able to bring this app into development and deployment. Okay, so when we get funded, what shall we do? So the first point here is that we will extend the app's reach beyond its initial target regions to cover more areas in Africa, focusing on underserved communities and regions with limited access to healthcare resources. Okay, our number 2M when we get funded is to invest in advanced technological infrastructures to support increased user traffic, data storage, processing capabilities, and ensure seamless performance and scalability in the app. So, sorry, the third point here is that we are going to innovate and expand the range of services offered by the app to provide comprehensive, integrated, and personalized healthcare solutions for users across the continuum of care. Okay, so this app is not particularly for only Africans. So if we get funded, we are going to reach out to some specific regions or continents of the world that are still dependent on the file management system, which is very prone to risk. The risk of file management system is very high. compared to the electronic health record system. So why the HealthVault app to start with? Okay, so someone might come up with a question, why the HealthVault app? Why did we think about it? Why did we focus our energies on it? So the first point here that I want to illuminate is that by centralizing health information records and providing immediate access to specialist contacts, the HealthVault app addresses the challenges of fragmented healthcare system, long waiting times of the hospitals, and limited access to specialized care, particularly in underserved regions. So when a patient potentially need a specialist, okay, and he or she goes to the hospital, and then the hospital seems to lack the basic technologies, or let me say the basic systems to use and treat this particular patient. So that hospital will tend to refer this patient to another hospital, right? So when they do this referral, the other hospital will tend to request for the medical history of that patient with the previous hospital, okay? And that will take a lot of time, even before this current hospital will tend to attend to this patient. But using the electronic health system, this is not so, okay? It eliminates that delay by providing the data of that patient online already in this app. So the second hospital here in question will not need the request of that patient's data from that other hospital, but rather it will be clearly displayed on their screen. So any specialist in the second hospital can be able to run through this patient's medical records or the history to be able to see, okay, this is what is wrong with this patient, and this is how I'm going to attend to this patient. All right. So the second reason why we are deciding to work on this app is because it can significantly reduce delays in receiving timely medical attention, improve medical diagnosis and treatment outcomes, and ultimately save life. Our priority for developing this app is to save lives. Okay, so we have our sponsors or our enablers. First of all, the ALX, that is our chief enabler, because this app is being hosted and being done because of ALX. Okay, so other of our sponsors include the Mastercard Foundation that is partnering with ALX, also Salesforce and AWS. So I and my team, such as Michael King, Maureen Himdi, David Oni, Adiku Oladipo, David Okechi, are all the developers of this app. I remain Udochukwu Reginald, a data analyst student at ALX. Thank you very much.